It's no question that we live in a very strange world. Currently, there are more gyms, but also higher obesity rates than ever before. The topic of this interview is LCHF, low carbohydrate, high fat diets. To delve into this interesting topic, I spoke to 3 esteemed doctors to ask questions like whether fat makes you fat, if diabetes can really be put into remission with LCHF, and where carbs fit in. Dr. Tro Kalayjian is a board-certified internal medicine and obesity medicine physician who practices in New York City. Dr. Eric Westman is an internal medicine doctor and obesity specialist from West Virginia. He has been an authoritative source on keto and low-carb diets for over 20 years. Dr. Cucuzzella is a professor at West Virginia University's School of Medicine and an advocate for nutritional science. He has published several papers on the low-carbohydrate diet for diabetes and metabolic syndrome. Thank you for watching, and please don't forget to subscribe.
I knew I wanted to be a doctor since age 13. I saw my parents really sick. Myself, I was sick. My whole family was sick. Diabetes, obesity is rampant in my family, and I knew I wanted to be a doctor. I went to college. I studied health science, and I went to med school. And then afterwards, I went into an internal medicine residency in the Yale-affiliated internal medicine program. I was the chief resident. And then I got extra certification in obesity medicine. So I got board certified in obesity medicine thereafter. I've been practicing for roughly about 10 years. I've published 5 papers on obesity, binge eating, cholesterol, diabetes, and I've given lectures. I think the most interesting thing about me is not my medical background. It's the fact that I used to be 350 pounds, and I was a board certified doctor, resident, 350 pounds in the most prestigious academic institutions with access to the world's smartest doctors who really couldn't help me. So I had to learn how to reverse obesity. And I think that's, I have street cred, I think, more than anything else.
Well, I'm sure that's probably like the definition of it.
I'm in North Carolina at Duke University. Been at Duke University for 30 years now, over 30 years.
Are you a practicing doctor or a professor?
Both. The first part of my career was more research focused, and the second half of my career is more teaching focused, which is often what happens in a clinical situation. So, my research is not basic science in the lab with test tubes and things like that. My laboratory, if you will, is the clinic. So I always started with clinical trials with people. And then when the clinical trials were sufficient to really be comfortable and open to practice, we did that at Duke. Now, 2007, we opened a clinical practice using low-carb diets for a wide array of medical problems. So I'm an internal medicine specialist and an associate professor of medicine with tenure. So I've done the clinical research track, and now mainly teaching, and people come to my clinic to learn, or I speak at meetings, and so that's really why I can be an associate professor with tenure and also a practicing doctor in a university practice at the same time.
Dr. Cucuzzella, thank you so much for joining us.
Mark is fine.
Is Mark fine?
Easier, just Mark.
Yes,
100%.
Mark, I have to ask, it looks like you are about to embark on some sort of activity.
Oh, no, I'm at work.
Looks like you're about to paraglide or something.
No, I have my badge, and, I've seen some amazing diabetes remissions just in the last 4 hours in my clinic.
The topic here today is LCHF. That's low carbohydrate, high fat dietary guidelines. What about LCHF drew you?
How I got started with this was two of my patients had phenomenal weight loss success. This is going back now to 1998, so a few years ago, when in my clinical practice at the Veterans Affairs Medical Center in Durham, North Carolina, where I've been since that time, two of my patients did this kind of diet and they lost a lot of weight. And I asked them, what did you do? And so it was observing the results in my patients that led me to be curious. I contacted doctors who had used this approach and then started our own research program at Duke. You know, and we all come to it in different ways. And
Yeah.
but what I was struck by how powerful this could be, because these patients did it without me. They didn't need a doctor. And you know, I thought, well, we'll do a few studies and everyone will be doing this. Well, 20 years has passed and clearly not everyone's doing it. But I got into it because I saw it having success in my patients, but I was worried about the safety of it. So that's why we started to do research on it.
So what I found was that what we were told was not exactly true. And it's not that I was false per se, and I'm not saying that people purposely misled us, although, you know, there's so much interest in that research area.
An African-American female who started at about 315 pounds, started doing this way of eating 2 months ago. So she was on 80 units of insulin.
And this way of eating, by
glipizide,
that you mean LCHF?
low carb. Yeah, LCHF. Yeah. So she comes in today and she has this amazing logbook, and I'm going to like write up what she did. So she's got this logbook that has a binder that has mood, food, blood sugar, blood pressure, exercise. Like she's just taking ownership, and she's done affirmations. So today she comes in, she's 30 pounds down. Her blood sugars are almost impeccably perfect. She's still taking 10 units of long-acting insulin in the morning, a little bit of metformin, but she can probably, today she's going to drop the long-acting insulin. Retired male, so he's 30 pounds down in 3 months, and his A1C went from 6.5 to 5.6 just on metformin. But again, like he feels great. Like he knows his self-sabotage now.
Am I correct in saying that in 1977, the US dietary guidelines came out, and that sort of is the Western dietary guideline model, and it changed everything?
Yeah, I mean, like, look, compare it to modern events, right? 2 years ago, we came out and said, you know, everybody get vaccinated and everybody wear a mask. And that's what people did. 80% got vaccinated, and people were wearing masks for a long time. I know South Africa is a little different. In the United States, we're roughly at that rate of vaccination. But people do what their doctors say, right? People generally like to follow what their doctors say, right? So when those dietary guidelines came out, so if you need proof, if people would follow, you know, I'm not going to talk about the merits of all the policies that have come out, and, you know, I'm not going to talk about that. But if you look at it from, do people follow these guidelines? They do. They very much do. They want to trust their doctors. They want to trust that message. So when the dietary guidelines came out in the 70s and said, eat, you know, 12 servings of grains and, you know, 5 to 7 fruit, people did it, right? They were scared of heart attacks. They didn't know. And this is what the experts said, right? So our food policies changed, and they also said, don't use butter. Don't eat animal fat, you know? And so we started to have these trans fats come in, and vegetable oils and all these different things. So it really was a marking point of a shift, right? And at the same time, Coca-Cola, McDonald's, Gatorade, you know, Kellogg's, they're pouring money into research, and that narrative continues, you know, until Atkins really starts to disrupt things in the 90s. But he was, you know, he was also criticized, right? And, he faced a lot of scrutiny. But over the last 20 years, the research is convincing.
There are generational differences, no question. And, you know, if you've grown up with sugar, you're going to want sugar. And I find although once you have diabetes, it's hard at any age. I think most um, younger folks want things to happen faster. Like when I was taught about immediate gratification isn't fast enough, right?
Yeah.
so that's where it's a balance of you have to really say, yes, this will work. Now, Nadia, I want to shade your language a little bit. It's not incredible in the sense that it's amazing that it works like randomly incredible. No, it's reliable. What's incredible and unbelievable is doctors don't know about it, so they don't believe it. So I want to. In fact, I used to say it's so unbelievable people don't believe it. Well, but no.
Do you think it's that they don't know about it, or that they just are so used to the US dietary guidelines from 1977 that
all of the above? Yeah, so they're
all of the
behind
above.
the times. They're pushed by pharmaceutical companies to use drugs rather than diet, and it's quicker to just prescribe a drug.
Low carbohydrate, high fat indicates there's provision made for carbohydrates in this diet.
Well, I'll take this first, then Mark. In a clinical setting, when I'm trying to reverse extreme obesity and diabetes and other metabolic problems, I use the very strict 20 total grams or less per day. The Virta Health company uses 30 total grams or less per day because it means you're going to be a fat burner. But I have a new book out called End Your Carb Confusion that actually has 3 different levels of carbs. So it depends what you're trying to accomplish. And we're doctors in a clinical setting where people can be extremely sick. I teach and treat people with heart failure and diabetes, lots of problems. Not everyone needs to do that, although many people will feel so much better when they get the carbs that low because they start burning fat and ketones as their primary fuel. So it really depends on the individual. The old days, Dr. Atkins said, find your own carb threshold by using ketones and all that. My patients don't want to do that.
What is a ketone?
Yeah, so keto diet really just means you're burning fat, or you have ketones in your blood that are higher than what someone else who eats carbs is not burning fat so much. They don't have the ketones in the blood. But you can make your own ketones from your own body fat, and that's what happens on a low LCHF diet. Your body fat creates ketones internally, and that substitutes for where sugar used to work so much.
Yeah.
So it turns out you don't ever have to eat sugar. This was one of the remarkable things that we had to really convince ourselves 20 years ago, embarking on research. So the body can make all of its own sugar, and you make ketones from the proteins and fats that you eat. But so keto today can be, people say, oh, you have to eat fat to be in ketosis. No, you don't. Or you have to drink ketones to be in ketosis. So ketosis just means fat burning.
So we're actually there's like a common thread of us underestimating our body's ability to take care of itself.
Well, that's a whole nother way to teach it. This is a very holistic approach, right? To take away junk foods and have real foods. But actually, Mark, how do you handle the carb level, the threshold?
Yeah, Nadia, very similar. So there's kind of 2 camps of people. There's your insulin-resistant, type 2 diabetic, pre-diabetic, PCOS. So those people, by definition, are carbohydrate intolerant, similar if you had a peanut allergy. So their metabolism, they cannot process the carbohydrates in a healthy way. So for those folks, the less is better in most cases. And I just view the carbs as incidental. So I'll give them similar vegetables. So I don't want them to be weighing broccoli and counting the carbs in broccoli. But if they eat the non-starchy vegetables, along with their meals, just as a side dish, just for flavor, for some micronutrients, for some fiber, they'll stay in that 20 to 30 gram zone.
Okay. You can be low carb, right? So lowering your carbs just means lowering your sugar, lowering your processed grains, lowering
But it
your
doesn't
carbohydrates.
mean no carbs whatsoever.
No, you can have vegetables. Vegetables don't impact your blood sugar, right? Typical vegetables like green leafy vegetables, right? They don't impact your blood sugar. Starches do.
Okay. So a piece of toast may just
be the end of like all your efforts, in other words?
It's against the principle of a low-carb diet. So if you want toast, you can make it with almond flour and some butter, and it tastes great, right? But the idea here is lower your carbohydrates as low as you can. Now, that has a lot of different names, right? Banting, Atkins, low-carb, keto,
Yeah.
right? It has a lot of different names, right? So they all basically mean lower your carbs as low as you can, right? Generally. And we're talking about not fibrous carbs. So we're not talking about lettuce. We're not talking about asparagus. We're not talking about broccoli. We're talking about the bread, the starches.
So fibrous carbs are all right.
Yeah, absolutely. Salads don't affect your blood sugar. They're perfectly fine. You know, peppers, zucchini, asparagus, all of these are fine. You know, yeah. So hearts of palm, avocado, all of these are okay. But so a higher fat approach may you may find yourself putting olive oil on these, right, when you're cooking them. You may put a little bit of butter on them. You may, enjoy fatty cuts of meat, or poultry with the skin, or fish with the skin, right? So a little bit higher fat. But you can also do a high protein variation where you have, trimmed sirloins and, salmon without the skin, and, chicken breast and skinless chicken thighs. So you can do this diet in a number of iterations depending on what your goals are. But they're all kind of the same. Lower your processed carbs, lower your sugars, and be less hungry. I think for most people, look, if you want to enjoy certain food, go ahead and enjoy it. Like if you're in Paris and you want to have a baguette, have a baguette. Like, we're meant to enjoy food. I think the more compromised your metabolism is, the less your body can tolerate, right? And it does take time for your body to adjust to this diet. So it can take, 2 or 3 weeks to ramp up your body's ability to burn fat for fuel, right? So it's a challenge, right? And if you do reintroduce carbohydrates, that process does, take a step back. But as long as your mind, hey, look, when I have that baguette in France, or when it's that birthday and I include this, I may get more hungry and I may have to take some time to regroup. I think not all is lost. We're meant to enjoy food. We have to find a way to reconcile how to live a healthy life and how to be a human, right? But most of my patients who have really severe diabetes, I tell them, once they see their blood sugars improve, I tell them, why would you want to go back, right? Why would you want to go back and risk eye injury, right? Losing your eyes, losing your limbs, getting a heart attack. Why would you want that? So if you're young and healthy and you have a more flexible metabolism, once a month having a minor indiscretion and you're okay about it mentally, you can come back to your diet, it's fine. So I think it really is up to the individual and why they're embarking on that journey. Not all is lost. You can have some carbohydrates, exercise a little bit, and be right back where you are. Yeah. And, so it's not an all or none.
Does following the LCHF diet, does it actually have the ability to put diabetes into remission?
100%. Yes, we do it in our clinic every day, without a doubt, right? So we have 5-year studies now showing that many people can sustain that remission for years, right? I published a study showing that people with an A1C of 12, I don't know if you guys use millimolars or, milligrams per deciliter, but an A1C of 12 is like a really scary patient with diabetes who would be on insulin. We've shown in months that level can be normalized. So it's multifactorial. You can make the blood sugars look better immediately. Long term, we have to figure out a way to sustain that, and we have to work on decreasing weight and increasing muscle, improving sleep. All these things affect blood sugar as well, right? So it is a multifactorial process, but 80+% is driven by carbohydrate and can be reversed by carbohydrate. But you have to understand, it's kind of like saying, should I wear a cast to prevent breaking a bone? Sure, it can prevent breaking a bone, but it's not the best idea to go around wearing a cast. But if you've broken the bone, it's a brilliant idea to wear a cast, right? It's a very brilliant idea. So if your metabolism is really compromised and it's quote unquote broken, right? Being very strict and low carb can help you. Absolutely. Does that mean that being low carb will prevent this? We're not sure, right? We're not exactly sure. So it's a complicated topic, but yes, absolutely. We do it in our clinic every day.
Yes. Type 2. So
Type
the
2.
adult onset. Yeah.
Okay.
I'd say 90.
And is type 2 worse than
95%.
type 1?
Oh, so
No, go ahead. You can take that. Yeah.
I mean, they're both serious conditions. The type 2, you don't require insulin. In type 1, you require insulin. It's really insulin, a lack of insulin deficiency. But we can't reverse type 1 diabetes, but definitely I would say 95% of type 2 diabetes can be reversed.
Everyone can get better. Like, even if it's not fully reversible, everyone can get better. And that decreases their cardiovascular risk.
That's so common still that most patients don't know, most people coming to me don't know that their type 2 diabetes can be reversed. It's not common knowledge in pop culture or in doctors' offices.
I've seen some amazing diabetes remissions just in the last 4 hours in my clinic. It's been actually like a wonderful morning. But I'm behind, and I'll be here doing my charts till 6:30 at night. But it's worth it when you go back and actually have to dictate these charts. It brings you joy. Yeah, and they ultimately don't need you anymore.
Just to close off with, does fat make you fat?
It depends on the context. Fat can make you fat, but for general population, most people, it's the carbs that make you fat. What you eat for the entire day matters. So if you took someone who eats carbs all day long and you give them a bar or the oil, it probably doesn't matter. But if you eat a low carb, you eat LCHF, you can have the oil, it won't make you fat.
Yeah.
But you have the bar and it will make you fat. So the path you're on matters. So it's like, you're driving on the right-hand side of the road. You don't go on the left-hand side of the road.
I mean, I think Dr. Robert Lustig explained this pretty well like 10 years ago. So the perfect storm is fat and carb at the same meal. So look at the perfect processed food. You have a ton of carbohydrates, which raise the insulin, but then you have this highly calorie-dense, palatable fat. So it would be like a processed pizza. It's all the carbs, all the fat, high calorie, no protein. The protein we need to make us full, right? So the junk food and protein here in South Africa, there's a lot of poverty. So protein is the most expensive macronutrient. This is the cherished macronutrient. So if we can't get people protein, the cheapest stuff is vegetable oil, cheap fat, and sugar and white flour. And then your brain doesn't even know. And that's the modern food environment, is a lot of carb, a lot of cheap, not like good Nina Teicholz fat, right? We're talking like a processed muffin. But yeah, fat and carbs at the same meal, buyer beware. It's not going to end up well. And we've witnessed that, all right? That's the last 40 years of human history. So we have the science to back that up, but all you have to do is witness the world. I mean, what has happened around the planet? It's not that people don't exercise. There's more gyms now than there were, when I was a kid. There were no gyms. We had the backyard. That's all we did.